Drugs is the reason I ended up here. I ended up here at the end of a long stint with heroin, a long run. I overdosed, and I had possession of drug paraphernalia in my pocket. And that's how I ended up here at Henrico County Jail. It's hard to be in jail and say, hey man, this is the best place for me. It was the place that I had to be in order to prepare myself to go back to where I want to be. I was delivering and rendering a lot of hurt at home. And I was hurting myself and hurting my family. The best thing was to separate me, and I wasn't doing it willingly. So coming to jail, you know, it actually helped place the mortar and the bricks to rebuild the bridge to my family.
If you don't quit using, you are either going to end up in jail, in an insane asylum, or 6 feet under. And I know that because I've been in all three. I have died, I've come back, but I mean, it's because I was lucky. A lot of people don't. So it's not just a little cliche that you hear, that is real life right there. I think it's amazing that you can end up in one of them, like jail, and then get the help that you need, because you really can't find this in every jail, for real.
I really believe that there's not a single opiate addict out there that wants to continue to be an addict. It's just that they can't quit. There's not a single person in jail charged with being an addict. They're charged with the consequences of the addiction. So those situations are not going to go away. What we really need to do is make jails the place to provide substance abuse treatment. I get thanked all the time by family members in the lobby of the jail for their way their family member has changed and what we've done. And yeah, I just think it's so easy to do. I mean, it's not a difficult process what we're doing. We're just providing them with the tools and the opportunity to learn about their addictions and learn about the things that have caused problems in their life, and to be able to make changes. By keeping them confined and giving them the opportunity to work on their addiction, they're freer in jail than they are out on the street.
I would call them, this is before they blocked the jail number, I would call them and they would bond me out with promises of, oh, I'll stay clean, I'll stay sober. And as soon as they bonded me out, what was I doing? I was sticking a needle in my arm. You know, so them leaving me in here and not helping and not putting money in my books and not coming to see me, that was a big, like, okay, I want my family back, you know, it did help. They went from not talking to me and wanting nothing to do with me to they come and see me at least once a week, minimum. My nanny looked at me and she said, you know, Taylor, I didn't think I'd ever get to say this to you, but I'm so proud of you. She was like, I see how much you've changed.
She had to stop feeling good about herself, and I owe that to the program, I really do. What a pleasure it is to be with her now. I mean, I love being with her. Her attitude was so bad. She was always on defense, and you just couldn't enjoy being around her. And but now, every time I see her, I see the old Taylor that's happy, feels good about herself.
I didn't understand what it really meant to be a father while I was using drugs. I thought I did, and after getting clean, I came to understanding that I wasn't a father at all. I was just a male figure.
This year's autograph for Academy 47 is Zachary Green.
My son stopped calling me dad. He would call me by my first name, he said, because I didn't act like a dad. Said, now I'm back to dad again, you know, and when we prepare or have things to do together, they look forward to it, and I do too. If I could say something to my kids right now, is that I love them, and I appreciate their support, and I won't leave them again.
Rather jail than, you know, something worse. So just grateful that he was in a good position, and I was blessed to have that program to help him out.
I know he's proud of you today.
Yeah, I'm proud of him. Proud of him.
I'm Brandon Brock, and I'm a person in recovery. I can show you some of the things that you need to look for as a parent. Some of them are old school, some of them are newer, and you may not know about. Let's see what we got here. Next, we got a pack of cigarettes. Empty pack of cigarettes with a glass pipe, typically used to smoke marijuana. And this is what a lot of drugs are coming in these days too, is lottery paper. First and foremost, it's used to package it in. And once the user gets it, you know, the user unfolds it, and it's pretty much ready. The drugs are down in there, it's typically a powder, and it's you know, ready for sniffing or, you know, scooping it out into something else. And they call it a fold. That's what it's typically referred to as. We also have a tourniquet. And this is where things get serious, because we have a tourniquet and a needle, syringe, used for injecting drugs. And this is, you know, I'm sure everyone's seen this, but now the kids have seen it and the kids know what to do with it. We also got this orange cap. And this is the cap of a syringe. Probably fell off. Kid didn't even realize it. And when you see something like this, you really want to be worried. Now let's take a look at the girl's backpack. Makeup case. This is where a lot of the girls put their stuff. I guess just because they feel comfortable with it. She has eye drops, and that's just to get the red eye out. Smoking marijuana, your eyes get red. That's the first indicator that someone's been smoking marijuana usually. Playing cards. She doesn't have a deck of cards, she just has two, which is an indication that she's using them for other things besides playing cards. It's to cut up or, you know, divvy up drugs. This is where the kids keep their pencils, pens, glue, miscellaneous items like this. But this was down in there, and at first I didn't even see it. This is what they call a grinder. Put the marijuana in there and you spin it around, and it pretty much crushes it up and gets it ready for use. You have the right to invade your child's privacy a little bit if it's for their safety. Kids are dying. Kids are dying with these drugs, the heroin and the fentanyl, and I think it's okay to do it, and I think you should be aware of what you're looking for. There's so many high-tech gadgets out nowadays. You can put drugs in mouses and USB drives, and you know, there's false books, and there's so many different things you gotta look for. And I think educating yourself on those things is very important as a parent.
My name is James Bandy. I'm a captain within Henrico County Police Department. Today we're with Sam and Chris in a typical teenager's bedroom, and hidden in plain sight is some drug paraphernalia, some items consistent with drug use that we're going to take a tour and see if we can identify. So here we have some Chore Boy, which is a common household item. And as you can see here, the Chore Boy acts as a filter, separating the drug from where you will actually inhale it into your lungs.
So LSD and acid is generally packaged in tabs, and tabs are generally sold in small aluminum containers like this, where it'll be folded up just like this. So if you see small bits of aluminum in the trash can unfolded like this, be wary of what your kid is using, and it's possible that a drug test may need to be administered because the kid could be using LSD or acid, which is a hallucinogenic drug.
Parents would never suspect that you would hide things in just a can for mints and candy. Deodorant is a pretty normal item for a teenager to have in their bed, but sometimes it can be indicative of a place where they can hide drugs in the bottom of it. It masks the smell of marijuana and cocaine and other things that kind of give off an odor.
Here we have another smoking device of common household items. You also see these with toilet paper rolls and aluminum foil.
What we have here is normal dryer sheets that you could just find in your laundry room. But if you're finding these in your kid's room, unless your kid really loves to do laundry, they generally aren't going to have dryer sheets up here. Dryer sheets are used to mask smells of marijuana and other kinds of drugs. So I would be wary of finding dryer sheets in a kid's room. Talking about betrayal of trust, I think that it all comes with a conversation, just being like, hey, we're going to go through your room periodically as you grow up, just to make sure that you're behaving. It's not because we're suspecting you of doing anything. It's just that is what parents do. That's what parents do to make sure that you're behaving and you're doing what you're supposed to be doing as a kid. And if everything comes back clean, then that's okay. The only time that kids generally protest is when the kid is doing something wrong.
The heroin epidemic is higher than it's ever been. We're dealing with serious drug problems in teenagers, and I think if teenagers have been doing something that's indicative of lying to their parents, trying to manipulate their parents, they're acting very unnatural, acting very sketchy, out of place, then I think trust is a two-way street, and a parent has every right to come and make sure that there's that accountability that a child needs now when they're surrounded by drugs.
We're in a society where we never want to feel pain, so the slightest amount of pain we run to the doctor for.
Long-term use lead to misuse and, of course, addiction eventually.
This past year, more people died due to opioid overdose than they did to gun violence or motor vehicle accidents, and so it has overtaken many of the common causes of death. And so we've got to really pay attention to these numbers. There's been a lot of work here in the county and regionally to develop strategies to address opioid usage.
The prediction that if we don't do anything drastic collectively as a society, that by 2025, we could have 100,000 people die from drug overdose in this country. Adam was my last child. He's a child that is so smart that I never thought he would have this kind of issue. But he had a shoulder injury that I think eventually, with that shoulder injury and the surgery that he had in the summer before I found out, is what tipped him to use possibly prescription medications, and from there on to go into heroin. I got the call on Saturday morning that he was found overdose and unresponsive. He was resuscitated, brought back. Unfortunately, he had enough brain ischemia that he was pronounced dead the following week on Wednesday. It could be you next, or it could be your child, it could be your niece, it could be your nephew. There's nobody protected from this disease. And as a result, everybody should put an effort. Not only doctors have to change the way they do things for the sake of the society, but parents have to change the way they do things. Teacher has to change the way they talk about drugs. Everybody has to change. The answer is very clear. The prescription medications are as harmful as the surgery itself. And the doctor has to be responsible and take the time to explain to the parents what this prescription is all about. What we know now that dental pain from extractions rarely lasts more than 3 days. Very minimal pain for the most part, the majority of cases, more than 7 days. In my new protocol, I give prescription to patients with non-opioids as the primary and the first initial prescription, meaning that I give ibuprofen on a scheduled basis for kids who have their wisdom teeth or patients who had extraction of teeth, or for that matter, minor procedure.
Regulatory authorities, our incentivization has been in place to make sure that we are addressing pain in our patients. And if we weren't prescribing pain medication, we'd get dinged on our customer satisfaction surveys. And so there are large system issues that have come into play that have led to the practice of overprescribing pain medications. And now, a decade later, we're starting to see the fallout of that.
Every single time you fill a prescription, well, that pulls to essential database. Well, back when I was using, they didn't have it. So I would jump around to pharmacies, jump around to doctors, because they couldn't all connect the dots. And now it's way different.
A lot of our efforts, statewide and nationally, have been developing prescription monitoring programs, really educating physicians around the impact of overprescribing, and making sure that systems are flagging when too much of an opioid is prescribed.
My advice for parents is the least number of days the kid is taking opioid, the better. And if they don't have to take them at all, that's even better.
I remember my parents, they always had pills in their medicine cabinet, which is how I ended up taking one. And just the curiosity of what kids do, it could hurt them and injure them.
One of the things that we are really honing in on is, where do people get opioids from? And the reality is that many originally get them from healthcare providers. They go in and they've got pain and they get a prescription, but they get a prescription for much more medication than they actually need. 68% of people actually got their opioids from somebody else. Without a prescription, just shared from a friend or a relative or somebody else who said, hey, you're in pain, why don't you take some of these? There's also recent data to show that really anything more than even 3 or 4 days on an opioid can lead to addiction. And so when you start to share those pills with a friend or a relative without meaning to, that can be the beginning of an addiction for them.
The Drug Enforcement Agency established the National Take Back Initiative, which is designed to give the general public an opportunity to dispose of unwanted prescription. We also take advantage of that time to educate the public on the dangers of misuse of prescriptions. The DEA has 2 Take Back initiatives yearly, in the spring and in the fall. We just recently had our Take Back this spring. In Henrico County, typically we have 1 disposal location. This year we expanded it to 3 to give greater access to the public. We took in over 1,000 pounds of unwanted prescriptions, which doubled our take back last year. So we had tremendous success. We not measured the success on how much prescription we took back, but the greater access we provided to the citizens of Henrico County.
It's not recommended to flush it and enter that medication into the public sewage system. And so really the best practice to dispose of medications is to use a medication disposal kit. There's a steady availability of drug disposal kits that are being handed out through health departments. They are very simple to use. Inside it's filled with activated carbon, and so what happens is you rip off the top, you put as much medication, it'll take up to 45 pills, and then you fill it up with warm water, and there's a Ziploc. So you just zip it up, and then it can go in the normal trash can. And the great thing about it is that it doesn't, outside of this, it doesn't take a special disposal pathway. You can put it in the trash to be picked up. It's biodegradable, so it'll degrade in the landfill. And it really is the most effective way to get rid of leftover medications to make sure they don't get in the wrong hands.
Nobody should have opioid in their cabinets beyond the 7 days after their surgery. 7 days, if you haven't had enough, if you're not needing them in 7 days, you need to get rid of them. So no cabinets in America should have opioid or addictive medications anymore.
This is Narcan, and this is the brand name for Naloxone, and this is the nasal spray that typically you will get at the trainings.
I overdosed several years ago, and if it wasn't for Narcan, I probably wouldn't be here today. And when the ambulance first pulled up, that's what they gave me.
Opioid use is at an epidemic level now in our community, and I think that people are afraid sometimes because they don't understand it. By educating people on how to use Naloxone, it takes the fear away. Almost everyone who takes the training comes away feeling very confident in how to use Naloxone and the ability to administer it. It's a very short training, and when you finish that training, you have your card that says you are certified to administer Naloxone that you keep in your wallet.
It's no different than somebody going into diabetic shock. I have diabetes, and I could go into diabetic shock at any point. But I have things that can save me from doing that. But with heroin use or any type of overdose like that, it would be helpful to have something, I don't care who you are, just to have this device to save a life.
I think a lot more people nowadays, when you get your drugs, you normally go somewhere and try them out first, in very public places, because that's where a bathroom is. And like what we talked about, having defibrillators up on the wall, if people were trained with Narcan and you were to see that happening, you would be able to administer it to the people that were overdosing.
This is the kit that everybody gets when they're trained, and this is a kit that you can keep with you that keeps all of your supplies for your Naloxone. It has in it, you'll get a card in here that will walk you through the steps. A lot of the people in the community have family members who may be active in addiction, but really anyone could come in contact with someone who happens to be in an overdose.
We're tired of mothers and fathers dying. We're tired of children dying. And this is one way that the public can help. Even if you don't know anything about drugs, just go to the training and learn about it and get your kit so that hopefully one day you can use it to save somebody's life.
We have to look at people as individuals because what works for one does not work for another. Medication is not going to fix you. Going into a treatment center and coming out, or a detox, especially and coming out, is not going to fix you. Detox usually gets you clean just long enough to want to use again. You need to follow that with some counseling, with some support. The life that people lead in addiction becomes one of hopelessness and despair.
When I got to the end of the road, I was looking around and I realized that I had nothing and no one left. And I was scared. I was really, really scared. Suddenly changes happen, you know, for lack of better terms, miracles happen. When I just decided that I don't want to be a part of this drug use life anymore. And, you know, before I realized that everyone in the recovery life was reaching out their hand saying, we want you to be a part of our life. And that felt good, and I joined up, and now I feel like I can't, you know, it's so simple, just this idea of being a part of something, but it has totally changed the game, because I've never felt like I was a part of anything, and it was miserable, and now I feel like I have somewhere that I belong.
The process of recovery would be so much better if the community at large educated themselves on treatment and on recovery and on this disease that is substance abuse. That way, people who are struggling with substance abuse, that way people who are struggling have somewhere to go and have people to reach out to when they reach the end of their rope.
One of the things that they hear in peer recovery is the term happy, joyous, and free. And that's something to strive for, not just for yourself, but for the people around you, because hopefully if you stick with it and you stay in recovery, you keep working on yourself, you keep addressing the issues that you have that brought you to that place where you needed to stop feeling in the first place.
Each time it was like an hour window where I was like, all right, I'm gonna go get help. And really, I never knew that you could do same-day access at Henrico County, or you could now go into some hospitals and say, you know, I want to get off it. I think even the Richmond police station, you can say you're on heroin. You can go down there and say, I want to get help. And if you're willing and you want it that hard, that's what you're going to do. I can't force anybody to want recovery. And that's the thing. You need to want it for yourself, because otherwise it's not going to work. There needs to be something in you so sick and tired of what you used to be that you're willing to work as hard as you did on your recovery as you did for your drugs. And that's the thing.
People who stay clean long term usually are involved in treatment and peer recovery. The combination of both has the better outcomes and long-term involvement. So it's not an either or, it's a both. Typically provides better outcomes for people. There's Narcotics Anonymous, Alcoholics Anonymous, Smart Recovery, which is kind of a behavior modification, cognitive processing, and that typically is somebody, a peer who's been trained, and they facilitate those meetings. There's also Refuge Recovery, which is based on Buddhist philosophies. There are recovery churches. So there are multiple pathways out there. You can't do it by yourself. That's the main thing.